If you are active and you're just looking to switch accreditors, or maybe you were health department accredited and now you're like looking for an accreditation company for like referral sources or whatever, it's a little less relevant of like the time frame between you say you're ready and them coming out and this and that. But if you're looking for an accreditation company for your enrollment, big difference about ready date to survey date. Hi everyone, my name is Mariam Treystman from the Home Health Consultant, and today we're going to be talking about how to choose your accreditor. But first, if you like our content, please like, share, and subscribe. So let's get into it. How do you choose an accreditor? What are some good comparison points? What are some questions to ask them? So first and foremost, like the obvious, like first question anybody asks is about cost. What does the accreditation cost? What are surveys costing, and so on? So here are some interesting little tidbits to think about whenever you are accreditor comparing. Accreditors typically are going to charge you for every survey. That's obvious, right? They're sending somebody out. They're usually flying somebody out to be on site with you for a couple of days and so on. So, of course, they're going to charge for this, and they charge a lot of money. Typically, their general cost structures for enrollments are going to be very similar or exactly the same. So when you're calling around, if you're just talking about enrollments, meaning licensure and accreditation, like Medicare deemed accreditation survey, or if you're in a state without licensure, then just the Medicare deemed accreditation survey, you're going to get about the same pricing from everybody. But it's still, of course, good to call and ask. Where you have price differences a lot of times is once you're active and you start working and you get into, the resurvey fee and things like that. That's where it gets a little bit tricky. So we are still being charged per survey, but with some accreditors, like specifically Joint Commission, they charge an annual fee. I don't think CHAP charges an annual fee. ACHC does not charge an annual fee as of June 2025. And so once you're getting into the resurvey fee, meaning the survey fee for the every 3-year survey that, you have to do the 3-year survey to maintain your Medicare accreditation and so on. Once you're talking about that specific survey, the prices wildly differ. So for ACHC, the difference between ACHC and Joint Commission is like $2,000 or $3,000 for the survey. It's like a big difference. And so if you're just calling and asking, what are your survey fees? How much is this kind of survey? How much is this kind of survey? It will look like Joint Commission is the cheapest of the 3 accreditors. However, Joint Commission charges an annual fee based on what kind of census you have. This annual fee is, I think, about $2,000 minimally, and then it goes up based on your census. Please don't quote me exact. This is approximates. But once you start adding up the annual fee versus the survey fees, you start to realize that the Joint Commission actually charges significantly more for their accreditation once you're in this active 3-year cycle than the other 2 accreditors. This structure can change anytime. So unless you're literally watching this June 15 of 2025, make sure to check and double check what I'm saying. But pretty much the difference between Joint Commission and the other 2 accreditors, ACHC and CHAP, in terms of fees, you're gonna be paying about $3,000 to $5,000 more ultimately for the 3 years with Joint Commission than with the other 2 accreditors. So definitely one thing to consider is, do they charge an annual fee? Not just how much are their surveys. So like the 3-year survey for ACHC and I believe for CHAP is about $9,000. Approximately. That might differ. That might differ tomorrow. That also might differ based on if you're home health or hospice. So like it's not exactly right. It's like 9,100, whatever to the cent. With Joint Commission, they're charging about 4,500 or 5,000 for the survey. But then you'll have 3 years of annual fee on top of that, which is at least another $6,000. So that's what I mean when I say Joint Commission comes out to being a little more expensive. Next, since we're talking about cost, you really want to consider the return on investment. Nowadays, Medicare kind of requires you to go through these accreditors, definitely in California, but probably in a lot of other states too. And many states don't even have a licensure process. The health department doesn't really do surveys like that everywhere. So we're just talking about going through an accreditor. If you are going through an accreditor, there may be a slight difference of preference for your referral sources. For example, like 20 years ago or whatever, when I started in home health, it was that any hospital that you would contract with would want you to be Joint Commission accredited. That was because they were Joint Commission accredited. So they wanted to make sure that the standards that they upheld in the hospital flowed onto the other providers that they will be referring to. Nowadays, everyone's accredited by different things. And at least in California, I haven't seen a big preference towards one accreditor or the other by major hospitals and things like that. But it's worth checking. If you already have an idea of the kinds of referrers you're going to want to work with, it's worth checking to see if they care if you're accredited by an accreditation company, or if just like straight Medicare is fine. You know, if your health department has this option and the referral sources aren't going to have, care either way. Well, at least in California, when the health department was conducting these surveys, the surveys were free. We didn't pay for them. Versus we're paying like $9,000 per survey without accreditor. It's expensive. So my point is, accreditation is great. But like, for example, in California, when the hospitals were requiring Joint Commission accreditation, it was when most agencies were simply accredited by the health department. And so the additional accreditation was kind of an indicator of quality, like you're going above and beyond and doing better services, providing better services. Nowadays in California, it's just not like that because the health department is not doing any of these surveys. They're just like not, and that's that. They're outsourcing to accreditors. So no matter what company you have, unless they've been around for like over 15, 20 years, they are definitely going to be accredited by one of these accreditors. So please mind your state practices with this. But a lot of times just going with your like state health department, if they provide this kind of survey, is much, much more cost effective than going with an accreditor. So you really want to consider your ROI with the accreditor. If your state and referring environment looks at accreditation the way we used to look at it in California back when it wasn't a mandatory requirement, then maybe it makes sense to pay this $9,000 and keep having, every 3 years, these massive expenses for surveys to maintain that accreditation, because it will help, it'll help essentially pick you out of the crowd of agencies and signify that you're a great agency. But if it's like California now, where every single person, no matter who's starting a company where in California, you have to go through an accreditation company. So at that point, it kind of like, there's no difference between this one or that one in the eyes of like refers here in this way because everyone's accredited and stuff like that. So you really want to like check out your environment with the referral sources and see if they even care that you have accreditation, or if you want to go with a health department, if that's an option, or if they have a preference over which accreditor. So that's definitely something you want to consider. It's not a question you're asking the accreditation company necessarily, but it is something that you want to consider when you're considering cost and things like that. The next concept I want you guys to think about is just the interaction with the account rep and how they manage your account in the accreditation companies. So between the three accreditors, you have this different way of doing things. You really want to consider what is your vibe? Do you want to never talk to somebody and just go in some portal and do all your stuff and you don't want to ask any questions? You just kind of want to work within your portal? Do you want to only communicate with somebody and just ask questions and have this personal interaction and anytime you need something, you call them, you ask them? Or do you want some hybrid where some things you can do there in a portal, some things you don't, whatever? For example, I'd rather die than talk to a human, in a sales situation or things like that. So I like a very techie environment where I can do things. But for example, where I see a negative in nothing but techie is that if there's an issue I'm having, yeah, my account rep can help me, my account rep this, my account rep that, right? But I do want my hand held when I want it held. I don't want to just be thrown into a portal, here, it's in here, like this. So just depends on your kind of attitude and what you're looking for with an accreditor. The other thing you want to consider with the account management and account rep stuff is how accommodating, forgiving, educational, and are they going to treat you with grace? This kind of human touch, right? I don't want to comment too much on this stuff. We have feelings about it. This kind of attitude also, if you're just really considering accreditation as a long-term decision, and of course it is a long-term decision, right? If you could, not to the accreditor, but to other people who have used their accreditation services, ask about the attitudes of surveyors, because they are very different. All surveyors in all three companies are going to cite deficiencies if they find them. So we're not talking about are they gonna, close their eyes on something? No, it's not. That's not what we're talking about. But there's, right, you can give somebody bad news in a way that crushes them or in a way that keeps their spirits up. So, ask around and see what people's experiences have been with the different accreditors. Another consideration is, how does scheduling work with this company? So if you are active and you're just looking to switch accreditors, or maybe you were health department accredited and now you're looking for an accreditation company for referral sources or whatever, then kind of it's a little less relevant of the time frame between you say you're ready and them coming out and this and that. But if you're looking for an accreditation company for your enrollment, big difference about ready date to survey date. Because if you're enrolling and you're looking for an accreditation company, you have to have a certain number of patients, right? To pass the survey. So a certain number of active patients. It's very hard to time 7 or 5 active, whatever, let's say, right? Whatever it is, patients for your company. If their episode will end before the survey comes, and now are you resorting 7 patients to still qualify for this survey, but maybe they don't need research. Now you're scrambling to find another patient. So survey scheduling times are very, very important when you're considering enrollments. Because if their survey scheduling goes from ready date to survey about 3 months, that's the worst. That's it, that really sucks. Because look, most episodes, home health episodes are 60 days. Hospice episodes are 90 days. You probably aren't sending a ready date until you have at least all 7. I'm just going to talk in home health terms and then translate this to hospice, whatever. If you have all of the referrals in your hand, that's probably when you're sending the ready date. Now you're admitting and now you're, whatever, to allow as much time for you to wait for the survey and the survey comes. Otherwise, you're running into this place where, oh, my survey hasn't come, but I have to discharge a recert, and now I have to find more patients, and now I'm not billing for these, I'm not getting reimbursed for these, so that could be a financial strain and things like that. So that's a really big consideration if you are just enrolling and you don't have all of these active referral sources lined up that are just like regularly referring. Because when you're active, you don't need actually 7 active or 3 active or whatever it is patients. There might be some number of patients they need to look at to conduct a proper survey. But if you're active, you're probably receiving some regular referral flow, no matter how small or how big. So you're not really worrying like, am I going to have patients at all when they come? Like, that's not really something you're worried about as an active agency. But as an enrollment agency, it's like detrimental because like if they come and you've discharged one of your patients and now you have one less patient, you can't do the survey, but they will all charge you the cancellation fee. But the problem is that even if they say that their survey frame is like 3 months, that doesn't mean that they're coming in 3 months. You could send your readiness date and they can come the next, that's happened. They can come the literal next day because you've said you're ready. That's it. The minute you're ready, you're ready. And they can come anytime. So you definitely want to make sure that you have the patients at least at referral, but definitely in some kind of admission process. When you have sent the ready date, because they could come the literal next day. If there's a cancellation so you might be asking how, why, right? But if there's a cancellation in your area, they'll just pick like the next convenient agency. If you get lucky or unlucky, depending on what you're, how you feel about this or what you're doing, if like in the next door building, there's a cancellation, you're the one getting surveyed next. So the minute you send that ready date, Wild West, you have no idea what's going on, and you don't know what's going on by design. So that brings us back to survey scheduling for active companies. For active companies, we have joint commission that essentially through their annual fee makes you sign their contract every year all over again. And in that contract, in the paying of the annual fee, you are allowing them to survey you anytime in that year. Whereas with other accreditors, you're kind of like recontracting for the survey every time. And so with joint commission, if you're expiring, whatever, if your accreditation is expiring, they can come anytime 6 months before or about 3 months after. This is like about the regular surveying window. And you have no idea, like literally 6 months before, there's no trigger is what I'm trying to say. With the other 2 accreditors, there's some kind of, you submit a readiness date or something. There's like, you pay some deposit towards your survey because they don't have that annual fee. So they need to initiate this survey somehow. You have a better grasp at just general timing through that kind of process because, and I'm not saying like you have any idea when they're good. They can still come 6 months before, 3 months after. They could take like from the time you submit that stuff, they could take 1 year to come, that's on them and their scheduling. They don't have to, they cannot notify you by law. So it's not to say that you have control over when they come, but there's some kind of emotional trigger in your head that goes, from this moment, I'm waiting. And sometimes we need that. But sometimes it's easier just have some annual fee going, right? If you're a big agency and this like 1,000-2,000 difference doesn't matter to you on a big, every 3 years, there's 2,000 more. Like if that's irrelevant to you and you just want to have like less thought process behind all of it and just have auto processes rolling, great. Then the annual fee and that whole system works perfectly for you, especially if if your company is always ready, which is what we want. we want you to always be ready. It doesn't matter who walks in, if it's health department, if it's joint commission, right? So the goal is to get to a point with your company that kind of doesn't matter if a surveyor walks in or not. Of course, it's annoying, but it's only annoying. It's not like everyone's in a panic. What are we going to do? Scramble, scramble. We don't want that. But anyways, that's a different topic, a different video. Some other things you want to talk about with them when you're doing scheduling, whether it's active or enrollment. Well, what's their thing on holidays? Do they survey on holidays? Like, how does that whole thing work? What holidays are they surveying or not? We actually are, we've released an article about Accreditor holiday comparisons, so you can go read that on our site. But pretty much it's worth asking. Please read the article if you're interested, but also definitely ask them anyways in case things have changed. Another idea is block dates. So back in the day, a couple of years ago, this actually came to an end. But back in the day, you were able to specify for any surveying period about 10 days in which you are not available. So like, for example, I'll give you a really good example. My husband and I, we used to own an agency before we were married. We owned an agency together and we used joint commission as our accreditor. And then we got engaged and then we set our wedding date. And lo and behold, the survey came so we blocked off the day after our wedding date, pretty much like the weeks after, right? Because joint commission you don't like say, I'm ready. And then they come. They can just come anywhere. So our wedding was right in their surveying window. And so we blocked off 10 days for our wedding. And we went like on a trip right after for like 4 days or something. So we blocked essentially the week of our wedding off. And guess what? The survey came the next Monday. Which is great that we blocked it off and they didn't come the day after our wedding. But my point is, back in the day, you used to be able to do a block date. Now, as of like 2023 or 2024, CMS has said no more block dates. So that's not a thing anymore. But you still want to ask like, hey, so what if I get married in this time or whatever, this kind of situation? Like, can I tell you that like, hey, I'm getting married in this weekend. Can we like not do it this exact week? Or just talk to them about that kind of stuff. Because now that you can't do block dates officially, there might be different processes, or maybe they'll consider it during scheduling or, whatever. They might have some kind of like, maybe they have a process for extreme situations or I don't know, whatever. So that's something really to consider. Do I have something coming up in this next whatever period window? And how do I work around it? If not, how do I proof the company so that I can be gone, but if a survey comes, we're still okay, things like that. Next, you want to consider survey length and scope. So what does that mean? The accreditors differ on how many days they survey for different things. Sometimes they survey for 2 days, sometimes they survey for 3 days. That is a big difference if you're stressed out about it. And if you're in enrollment, that's a big difference because that's just, whether you're perfectly ready or not, it's still always just going to be a little nerve-wracking. And probably the staff of your company have other full-time jobs. Like, let's be real, right? Like, if you are enrolling, you're not keeping a whole full-time staff. Everyone probably works a little bit with your company, works mostly with other companies, and then maybe you have agreements with them that they will be full-time once you're up and running actively. Because it doesn't take 7 full-time staff members to do 7 active patients or 3 active patients. But so the length of the survey is going to matter both for your bottom line in paying staff full 3 days of being on site and going through the survey process versus 2 days. That's a 1/3 difference in payroll during that time. But also it's just like 1 day less stress, honestly. And if you're active, That's one less day of interrupted processes for you. So you really want to consider survey length. And when I say scope, this is what I mean. Every accreditor always checks you for COPs, conditions of participation, no matter what, right? Like that's the point of this survey. But they also add their own set of rules on top of it. And so, okay, the difference between the Joint Commission rules and the ACHC rules are like Joint Commission rules are about this thick and ACHC rules are about this thick. So like that's about this much thickness more of pages of stuff you have to do. Stuff you have to do. So you really, really want to ask about that because, again, if you don't have any ROI-based reason to go with the more expensive, harder guy that surveys for a longer time, maybe we go with a little bit of an easier option. So that's kind of what I'm trying to say here. So you can ask about that. Like literally you can be like, how many pages are your standards? And just see what they say. So that's pretty much it on creditor comparisons and things that you should ask and consider when you are trying to choose an accreditor or if you're considering switching to and from an accreditor. And again, my name is Mariam Treystman from the Home Health Consultant, and this is how to choose an accreditor. Thank you. Bye.